Welcome to Discovering True Health, where our goal is to provide you with cutting-edge health information through research, interviews with experts, and personal journeys to true health. Our message is a message of hope and healing, and our mission is to bring you on a journey to discovering true health, to not only find wellness, but to thrive. Hello and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for joining us today. Don't forget to hit that subscribe button to stay up to date on all our upcoming shows. We also have a lot of great information on our website, Instagram, or Facebook. All those links are below. So today we're going to be talking about chronic reproductive health disorders, specifically endometriosis. We'll be discussing what it is, what the early signs are to look out for, how we can manage the symptoms and heal our hormones with lifestyle and nutrition. And we'll also be talking about what we can do to prevent getting a reproductive health issue. And just to give you an understanding of the magnitude of this health issue, globally, 1 in 10 women are affected by a chronic reproductive health disorder. And many women don't know they have a condition until they're ready to conceive. So this is definitely a topic we need to be aware of and educate ourselves on. So my guest today is Laura Ibragimova. She's a holistic wellness coach. In her work, she helps women with chronic reproductive health disorders, helping them improve their health and balance their hormones. So thank you for joining me today, Laura.
Thank you so much for having me.
Now, you were diagnosed with a reproductive health disorder at a very young age, which was a very difficult journey for you, and it led you to really take control of your own health and become an expert on reproductive health issues, and in turn, help other women. So can you share with us your experience and journey and what you learned from it?
Yeah, so my journey was certainly very rocky and very confusing. I was diagnosed with endometriosis in my early 20s, but I had been experiencing what I now understand to be symptoms since early puberty. I didn't have the typical symptoms of painful periods or nausea, which is important to keep in mind because every person experiences a reproductive health disorder or any kind of chronic illness differently. But I did have heavy periods and a lot of digestive problems. I did visit a lot of doctors throughout the process, and they all told me that everything seemed pretty normal, just maybe change up your diet a little bit and drink more water. And it wasn't until I noticed a persistent, dull, nagging pain in my lower right pelvic area that just wouldn't go away that I finally decided to get it checked out with a gynecologist. And so we did a sonogram, and my doctor saw a complex cyst, which is a dark fluid-filled cyst on my right ovary. And she pretty much thought that it was endometriosis, but needed to confirm with further procedures. And so that's where I went through the process of meeting with surgeons and getting diagnosed through laparoscopy. And even after that, I was still pretty in the dark about my diagnosis and what this meant for me and my health and my future. And so what I learned from that pretty painfully from this experience is that your medical care really is only one part of your journey. There's so much more that the doctors, don't really discuss with you and can't really help you with. And the bulk of your healing and treatment really relies on you and your lifestyle and really how much you're willing to advocate for yourself.
Absolutely. Now, what is endometriosis for those that don't know, and how is it typically treated by the medical community? I know you mentioned a cyst. Is that typically what it is, or kind of describe the basics for us?
Yeah, so it's really a complex condition. It's an inflammatory disease of the reproductive organs where tissue that is similar to the endometrial lining of your uterus finds itself outside of the uterus and in the abdominal cavity. It's typically labeled as a hormonal imbalance. However, new research shows that it's actually an immunodeficiency that's tied to your gut microbiome, where more than 80% of your immune system is developed. It feeds off of excess estrogen in the bloodstream, which causes the lesions, cysts, and scar tissue to form on the abdominal wall and organs surrounding that area, which leads to significant amount of pain and discomfort. Like you mentioned, 1 in 10 women are diagnosed with the disease worldwide, but because it takes an average of 8 years to reach a diagnosis, I really believe that that number is a lot higher. It's diagnosed through a laparoscopic procedure. That's the gold standard, where doctors will remove the endometrial adhesions and then biopsy the tissue to confirm that it is endometriosis. And from there, the doctors will prescribe hormone therapy or birth control.
Wow. So basically like you said, the lesions and cysts are kind of a symptom of it, not the root cause of it.
Right.
Fascinating. Now, what are some early signs that we should be looking out for? And is this something, obviously it sounds like, the earlier we catch it, the better.
So this is where it gets tricky because the symptoms often overlap with many other health issues, such as irritable bowel syndrome. But there are early signs to look out for. So endometriosis is categorized into 4 stages, and severities of your symptoms do not necessarily correlate to the stage of your diagnosis. So stage 1 through 4, from mild to severe, from minimal to severe, sorry. So I would definitely agree that early diagnosis is key to preventing damage to organs and fertility. So some of the early symptoms to look out for, and that can start as early as, early stage puberty. It can also be triggered later on in life, would be digestive problems, constipation, bloating, irritable bowel syndrome, or an irritable bowel disorder, heavy bleeding or painful periods, or even blood clots in your period. And that's a sign of high estrogen or excess estrogen levels in the body. Around your period, you could experience some nausea, severe fatigue, mood swings, brain fog or forgetfulness, back pain. And then at a later stage, it would be infertility. And a lot of women don't find out that they have endometriosis or any other chronic reproductive health disorder until they're trying to conceive, and it's just not happening. Endometriosis also has a high recurrence rate, especially if it's not managed properly. So if you're on certain medications or you've gone through certain procedures, these are some symptoms to also look out for, because perhaps the medication isn't working for you. So yeah, there's a lot of different symptoms, and it's really important to be very mindful. And if you haven't reached the diagnosis yet, make sure to bring that up with your doctor.
Wow. So you just mentioned how it can reoccur. So for example, if you have a cyst and you're diagnosed and you do surgery and remove that cyst, you can still get it again because they didn't heal the actual root cause of it. Is that kind of?
Yeah, so like I mentioned earlier, it's connected to a gut microbiome imbalance where 80% of your immune system is developed. Now, there's a specific cluster of bacteria in your gut, good bacteria in your gut, that is specifically designed to metabolize and detoxify estrogen from your body. If there's an imbalance there, then you can have free floating estrogen throughout your body, and it's going to go back into your liver and be circulated back into, all the areas where your blood needs to go to circulate, and just creating excess hormones and in imbalance in that way. So if you're not healing yourself through other ways, I mean, that's just one stage of the process, right? So if you're not then improving other areas of your life through lifestyle and, properly detoxing your body and having, regular bowel movements and so forth, you're creating the environment for it to grow again.
Wow, fascinating. So, you can get the surgery, but you also need to focus on the gut, healing the gut, which is kind of where the root cause of it is. And in turn, that
Yes.
will kind of help prevent it from reoccurring once you've had the surgery.
Yeah. So the other thing is with the surgery, and we can talk about this as well, is that some surgeries are not very successful and don't do the best job in, clearing out all the adhesions. And there's microscopic endometrial cells that can grow from there. And so you need to work with a very skilled excision surgeon who can find all the microscopic endometriosis that's adhered to any parts of the organs that some doctors don't know how to properly remove. Without that, then you're allowing for, it to stay there and grow, because it follows the same cycle as your menstrual cycle. So every month it's going to continue to grow. And because it has nowhere to exit, like you would through, your uterus has the vaginal canal in your body, in your abdominal cavity, there's nowhere for it to go. So it's just going to continue bleeding within, the organs, well, on top of different organs, and just continue to grow from there. So
Wow.
that's why it's so complex.
Right. So it's the gut plus finding the right doctor who has the right knowledge to actually get the whole thing eliminated with the surgery. Now, we talked a bit about prevention. What can parents do? Because you talked about, possibly starting very young, puberty, it can kind of start. What can parents do to protect their daughters? Are there preventative steps that we can all take?
Yes, so I think that parents are key to early diagnosis and making sure that young girls get the proper treatment. In my case, my parents didn't have any knowledge of endometriosis. I come from an immigrant family, so we also didn't really know how to navigate the, society here, medical system. So it was a bit of a challenge for me. And until I started learning more about it, that's when I started realizing what obstacles I had to overcome and why it took me a while to get my diagnosis. So I would say the first thing is having open communication with, the menstrual cycle, with your kids about the menstrual cycle, and teaching young girls about their bodies without it being a taboo subject, removing any shame or discomfort around that topic, because a lot of times people don't want to talk about it. And, meanwhile, all this is happening and they don't even know how to raise the subject. Also, feeling comfortable asking your daughters about their periods, and if they're feeling any symptoms, not dismissing them. If they're saying, I truly have painful symptoms, I don't want to go to school today, or I haven't had a bowel movement or something like that. And then advocating for their daughter's health when meeting with doctors, because even doctors will dismiss these symptoms from time to time. And also making sure that there's proper nutrition, because there is a strong connection between your nutrition and your gut health and your immune system. So when managing a condition like endometriosis, you want to teach your children how to eat anti-inflammatory and hormone balancing meals, avoiding processed foods and so forth. And one way to do that really is to invite your kids into the kitchen so that they can develop a healthy relationship with food and with their bodies, and understanding nutrition, and just really creating that open environment in the home to be able to have these types of conversations.
Yeah, absolutely. Now, let's talk a bit about mitigating symptoms and hormones for those who currently are living with endometriosis. How can, you just touched on this, with a preventative, how can lifestyle and nutrition help manage symptoms and help heal hormone imbalances?
So it's so important to have a good anti-inflammatory and hormone balancing lifestyle, and unfortunately the Western diet just isn't conducive to that, and it's just not something that we think about because it's fast food, it's easy food, and it tastes great, right?
Sugar.
Yeah. But how you eat really is how you live your life, and especially if you've been diagnosed with something, it can really determine the trajectory of your illness. Food really is the language of the body, and it directly affects your health through the production and secretion of hormones in the gut, by the nervous reflexes, through changes in concentration of various metabolites in the blood, or secondary to changes in circulating gut hormone levels, which we talked about. If you're not properly eliminating, then it's just recirculating and creating excess.
Building up toxicity in your body.
Exactly. So your diet and lifestyle choices really do have a major impact on your gut microbiome and your overall health. Now, I mentioned earlier that about 80% of your immune system is developed in your gut. So if your gut health is unbalanced, then your immune system is weakened, which makes you susceptible to all sorts of diseases and infections, as well as mood disorders like depression and anxiety, and also leads to increased inflammation in the body. And because endometriosis is a highly inflammatory condition, if you have exacerbated inflammation through other organ systems, then you're just, worsening your symptoms and preventing your body from healing itself.
Yeah, that makes a lot of sense. I mean, I've had a lot of guests on the show talking about this, talking about the gut health, and the gut really is the control center for our body.
Mhm.
It builds, affects the brain a lot. It controls all our organs. It controls our immune system. It's so vital. And yeah, and like you said, inflammation, that's That's key. Inflammatory state creates disease. That's the best state of being for a disease to grow.
Exactly.
So what are now in your program, you help women develop a lifestyle-based self-care routine. What would be your top 5 most important self-care practices?
So in my practice, I do teach a lot about being very attuned with your body, but it all starts with education and learning more about your body and the diagnosis, which is the best way to make sure that you're speaking to knowledgeable doctors and getting the right treatment. So don't live in the dark about what's happening to you, and become a partner in your medical treatment plan. So that's where it's really important to have that education and that knowledge, because your doctors will not educate you about your body or your condition. That's really your responsibility. They'll diagnose you, they'll tell you what's going on, they'll give you a treatment plan, they'll prescribe you medication, but further than that, it's your responsibility to learn more about what's happening with you. And then again, like I said, you want to make sure you're working with the right doctor. So knowing more about the condition will tell you whether or not you're speaking to someone who's keeping up with the research and knowledgeable as well. The second thing I would say is stress management. Many of us don't realize how stress affects our bodies and how we think. And, in general, we think that, if we've gone through the day without any scars or cuts or anything like that, that we're pretty fine. But stress really does affect us at an organ system level. And again, with the hormones, when cortisol levels are high, all other non-essential functions like digestion are shut down. And that leads to negative consequences. That leads to food just sitting in your gut and building up toxicity and increasing inflammation. So managing your stress is really important. And also learning how to eat properly when not stressed, because that has those two are actually really connected. We talked about nutrition, but I would put nutrition and sleep together, because sleep is so important in restoring your body back to health and balancing your hormones as well. Specifically, melatonin, which is the hormone that manages your sleep cycle, is also a potent antioxidant and anti-inflammatory. Really helps to restore the body, restore the muscles. If you've gone through surgery or any kind of injury, then you'll notice your body's a lot more tired because it needs to heal itself. So getting proper amount of sleep is really important. The fourth thing would be communication. Learning how to communicate your needs to your loved ones, your doctors, your coworkers, your bosses, anyone really in your life. So making sure that you're getting the treatment and the support that you need. I think a lot of people with chronic illnesses not only deal with the physiological stress of the condition, but also the environmental stress, because they don't want to be perceived as a sick person. So they continue to live their lives as if they don't need that extra support. Which can add additional stress onto their lives, but then maybe they don't have the best communication with the people in their life, which can also add to more stress, and so forth. So learning how to communicate effectively is really important. And then the fifth thing would be surrounding yourself with positive energy. Some of the things that my clients will say is that, since being diagnosed, I've been so unhappy. Things have gone wrong in my life beyond the diagnosis, because their mindset's just not right. So making sure that you're around good people who want the best for you, as well as inviting more joy into your life, doing the things that you love, because this will prevent you from letting the diagnosis define you, and realizing that you're still a whole person. You just, have this other area of your life that needs a little bit more attention. And not only that, there is some research, not a lot, but there is some research that supports that increasing positivity in your life really does improve your immune system and can reduce inflammation. So every little bit helps, right?
It's all connected.
Mhm.
Now, what I really love how you talk about the importance of asking the right questions and the power of choice when it comes to dealing with healthcare practitioners. What have you learned from your own experience on really taking control of your own health? And what are some examples of the right questions to ask?
This is such an important question, and I thank you so much for bringing it up, because I think a lot of people feel very vulnerable when speaking to their doctors. And again, you get diagnosed at different stages of your life. I was in my early 20s. I had absolutely no idea what endometriosis was, and I was, still very naive and not very confident. And so it's really important to feel that your doctor is a partner in your care. And again, endometriosis is still a vastly misunderstood and misdiagnosed condition, also very heavily under research. So many doctors who don't specialize or keep up with the research may not know how to properly manage your condition. And so you want to know that your health goes beyond surgery, beyond a pill. And like you said, asking the right questions is really important. So one of the first questions I would ask is, because it's diagnosed through surgery, a laparoscopic procedure, you want to ask your doctor, what type of surgery will you be performing? And so we talked about whether or not you'd get the right type of, cleaning out during the
Right.
procedure. So there's two types of procedures. There's ablation, where the top layer of the endometriosis is burned in hopes of damaging the tissue to the extent where it won't grow. That's proven to be very ineffective and actually can lead to it becoming even more aggressive in some cases. The second type of procedure is excision, where they remove the endometriosis from the root along with some healthy tissue so that you're really getting the whole thing. And so this actually requires a high degree of skill. And so you want to make sure that you're working with a reputable doctor with great reviews, maybe even through a referral, because again, it can pocket itself onto different organs and you want to prevent damage. So that's the second question. You want to ask your doctor, how will you ensure that my organs won't be damaged during surgery? A good doctor will have a skilled team working with them. Because endometriosis can grow in different organs, it can also spread to different areas of the body. You want to make sure that you're not just working with a doctor who only knows that one area, because it can grow on the lungs, it can grow in the diaphragm. So you want to ask these questions. And you want to make sure that they're working with a skilled team as well. So some doctors will actually be very quick to remove ovaries and tubes and a uterus, even during reproductive age, even to women who haven't had children yet. And that's not always necessary, because a skilled excision surgeon will know how to preserve the surrounding organs properly. And a third question, of course, there's so many questions to ask, but
Right.
it's,
These are like the
specific to
vital, like must ask questions.
right. So just the starting point, really, because again, it's your specific condition, as it's the way the condition affects you is very individual. So it would be, what would be the next steps after surgery? You want to make sure that you're comfortable with the doctor's plans for you after surgery. You want to discuss all options, including risks, benefits, side effects, and so forth, because a lot of the medication has its own negative side effects that further damage your gut microbiome and your gut health. So you also want to see how your doctor reacts when you say no to a particular treatment plan that you're not comfortable with, because you want to make sure that the doctor you're working with is compassionate and understanding to your needs, your current needs, but also your long-term needs, especially if you have plans of having kids down the line. You don't want to do anything that's going to affect your fertility. So I would start with those three questions.
Wow, thank you for that. That's absolutely so helpful. Now, for those that would like to connect with you, we can find you on your website or Instagram, and I can post those below. Are those the best kind of places to reach out for you?
Yes. So my website would be www.islandseayoga.com. And you can find all my contact information there as well. And I'm very active on my Instagram, so you can definitely check me out there at Island Sea Yoga. Yeah, feel free to DM me, message me. I love responding to questions. So those are the best places to reach me.
Perfect. And can you share with us what types of programs that you have available?
Yes, I'd love to. I'm very passionate about spreading awareness, and I'm also very passionate about letting people know that they have more options than they think, and there's so much more control of their body and their diagnosis than they think. So those are really the foundations for the programs that I offer. So I have different programs at different tiers. I offer a 15-day Heal Your Gut, Heal Your Life challenge, which is designed to rebalance your gut microbiome through healing nutrition and also really helping you to improve your relationship with food. I also have a signature program called the Endo Relieved program, and this is an 8-week hormone balancing program using healing nutrition and stress management to reboot your system. It's really taking on a whole systems approach because, like you mentioned, everything in the body is connected. You cannot just focus on one area of the body and think it's going to be healed. You have to really take a whole systems approach. And then I'm also a certified yoga instructor and meditation coach, and offer those services as well to minimize any stress and also help to create more peace in your life.
Beautiful. What an incredible combination. Now, before we wrap it up, do you have any final thoughts or words for those out there who are living with a reproductive health disorder and are looking to find healing?
Yes. So I would say first things first, don't feel defeated. Because chronic reproductive health disorders are so commonly dismissed and misunderstood, getting to a diagnosis is really only the start of your journey. You can have a lot of different emotions up until that point, but don't feel either defeated or don't feel like that's it and I'm stuck with a pill or anything like that for the rest of my life. So for someone who doesn't have a clear diagnosis yet, my best advice is to always advocate for yourself because no one will ever take better care of you than you, not your doctors, not your support system. So make sure to really study your symptoms and find a compassionate and expert doctor who's willing to listen to you and order the right tests and help you to get to a diagnosis. So don't settle with your doctor because they are a partner in your treatment plan. And then for someone who already has a diagnosis, really, really want you to understand that your medical care is only one piece of a very complex puzzle. As we've discussed, current standards of care only focus on suppressing hormones that feed the disease or removing organs rather than getting to the root cause. So managing your reproductive health really does take a whole systems approach in order to bring the body back to balance. And that includes lifestyle, dietary improvements that can reduce inflammation and really allow the body to start healing. We're powerful beings and we can heal. I'm not saying there's a cure, there's no known cure, but there is relief that's possible. So really taking ownership of your health and not taking no for an answer would be, a great place to start and really learning about yourself and your body as well.
Oh, so powerful. Well, thank you so much for joining us today, Laura. I learned so much, and I know everybody watching is going to get so much out of this. You shared so much wisdom and, help for those out there that are in this position. So thank you.
Thank you so much for having me.
Remember, knowledge is power. The more you understand your body, the better you're able to stay healthy and prevent disease. And a quick reminder, I'm not your doctor, so please don't take this as medical advice. If you have specific questions about your healthcare, feel free to reach out to your practitioner. And if you like this video, like and share it with others. This information could really help someone you may know. Also, don't forget to hit that subscribe button to be sure you don't miss out on our future shows. And stay tuned for the next episode of Discovering True Health.